Hello and welcome to How to Attract New Nurses, Reduce Turnover, and Help Nurses Succeed. GERI-RES, a transition to practice residency program for the long-term care nurse. We are very happy to have you all join us here today in order for us to discuss one of the most significant challenges today in the long-term care industry. And as you know, that is workforce. Having enough licensed nurses and ensuring competency for quality of care as well as compliance is really going to be crucial for success. Research shows that nurse residency programs improve nurse retention, lower costs, and improve nurse preparedness for safe and competent practice. GERI-RES is an evidence-based transition to practice residency program for long-term care nurses, has been instrumental in improving overall clinical outcomes, nurse preparedness, recruitment, and retention in skilled nursing and in assisted living settings. So today we are going to talk about the importance of a nurse residency program, including clinical support systems, its impact on recruitment and retention of clinical staff, as well as creating a professional development plan for long-term care nurses. We are honored today to have Dr. Barbara Bowers with us to discuss how a nurse residency program can assist with retention, recruitment, and improving quality outcomes. I am Sue LaGrange. I'm the Chief Nursing Officer at Pathway Health, and I am pleased to introduce Dr. Barbara Bowers. Dr. Bowers is Professor Emerita from the UW School of Nursing. Research focuses on frail, older adults and people with lifelong disabilities in both community and in residential settings. She is interested in how public policies, organizational practices, and models of care delivery influence quality of care and quality of work life for caregivers. Her interest in work-life quality for workers in long-term care systems has led her to examine causes of staff turnover, the relationships among organizational structure, organizational culture, management practices, and care outcomes, as well as to explore ways to improve the effectiveness of staff development. Her work with informal caregivers at home has led to the development of tools to provide anticipatory guidance and support caregiver decision-making. Professor Bowers is the founding director of the School of Nursing Center for Aging Research and Education. Professor Bowers is an expert in qualitative research methods. She serves on the editorial board of Qualitative Health Research, the Western Journal of Nursing Research, and the International Journal of Older People Nursing. She is associate editor for the gerontologist and oversees qualitative and mixed method research resources in the Institute for Clinical and Translational Research at the University of Wisconsin-Madison. Welcome, Dr. Bowers.
Thank you. Nice to be here. Excited to talk about this.
We're so excited to have you. We're going to start out today talking briefly about the landscape as we know it today. PHI quality care through quality jobs indicates that as the nation's leading authority on the direct care workforce, PHI promotes quality direct care jobs as the foundation for quality care. And in PHI's publication, Direct Care Workers in the United States, Key Facts of 2022, you can see that from 2016 to 2060, that the number of adults that are anticipated to be age 85 and older is expected to triple. PHI indicates that this demographic shift is the primary driver of job growth in the direct care workforce. But yet it's expected that adults aged 18 to 64 will stay relatively the same, which leads to less caregivers that will be available to assist older adults in the future. This slide addresses a growing need for assistance. Among those currently reaching retirement age, more than half, or 52% will require long-term services and support at some point, and for an average of 2 years. But by 2050, the number of individuals using paid LTSS in any setting will likely double from the 13 million who used services in 2000 to 27 million people. And by 2035, the number of older households with a disability will increase by 76% to reach 31.2 million. So as you can see, 17 million older household with mobility disability, 12 million with a self-care disability, and 27 million with activity disability. So we have that growing need for workers, and the nation will need that additional 2.5 million LTSS workers by 2030 to be able to keep up with the growth of America's aging population. So it will be up to us as leaders to collaborate on how we will recruit and retain enough staff to meet America's growing demand. So the need for healthcare workers will increase based upon growing demographics of the older population, as well as the workforce shortages in healthcare. And as you can see, the projected percentage increase in the number of positions employed in long-term care between 2010 and 2030 includes not just nursing, but 94% counselors and social workers, and 93% community and social workers, and 88 home health aides and personal care aides, 73% RNs, 70% LPNs, 69% building and ground maintenance workers, 68% nursing assistants, and food preparation and serving workers. So it is important that we really take a good look at these numbers. Now, per Health Leaders Media and the American Healthcare Association State of the Nursing Home Industry report, they indicate that nursing homes have struggled the most out of all healthcare organizations, with 210,000 jobs lost over the course of the pandemic. And the sector's 13% decline in workforce has lowered to its levels last seen since 1994. And at the current pace, which many of you are aware of, the nursing home workforce won't be back to pre-pandemic levels until 2027. And currently, they indicate 84% of facilities are experiencing moderate to high levels of staffing shortages. So workforce shortages are one of the top 3 priorities for long-term care organizations. And AHCA indicated that they found that 87% of nursing home providers, again, are facing those moderate to high staffing shortages, with nearly half, or 48%, struggling with a severe staffing shortage. Also, per AHCA, the average nursing home employee turnover rate is 53.3% within a year. And according to a 2022 study by the Long-Term Care Community Coalition, a New York-based nonprofit organization that focused on quality care, the national nursing home staff turnover rate for all employees is up to 25% from last year. Now, that's all according to findings included in the 45th Annual Nursing Home Salary and Benefits Report that was released Thursday by Hospital and Healthcare Compensation Services. So the nurse turnover cost an organization between $22,000 and $64,000 for one nurse in hiring and orientation expenses alone. Not only financial costs, but also cost to care and quality as well. And some thoughts to consider as we continue to try to recruit nurses as well as retain them is talent development. And that is a top recruitment and retention strategy in today's workforce marketplace. So shown here on the slide is a turnover calculator designed for your use. And so you can take a look at this. And I know, Barb, you do have some input on the cost of turnover and reasons for turnover in facilities as well.
Yeah, it's interesting. When I was at a conference, it was probably 5 or 6 years ago, when we asked administrators, it was DONs and administrators, how many there was a group of about 47 people there, and we asked them how many actually knew what their turnover cost, how many calculated the cost of turnover annually. Most of them actually didn't know their turnover statistics, how many people had left. And only one person in the room had ever tried to calculate the actual cost of turnover. There's some interesting research that's been done, and probably 8 out of 10 items on the list of cost are not things that people think about. I mean, it's advertising, it's the cost of agent having extra staff on either overtime or agency staff to fill in for somebody. But there's a whole lot of other non-financial costs as well to turnover. So, and I have to say, I mean, we spend a lot of time on recruitment, but turnover is actually, I think, the more important issue. It's a hole in the bottom of the boat. If we could actually retain our nurses, we wouldn't have to keep recruiting new ones, because we would have them there for a much longer period of time. So I really think this is where our hardest work is. I just want to tell 2 brief anecdotes. I've had 2 students in the last several years who have been determined, undergraduate students. They wanted to work in long-term care. They're absolutely committed. Both of them lasted less than 2 weeks. And I'm not going to go into the details of the sad stories, but they both had to do with pretty much a lack of an orientation program. So that here's new grads who felt completely at sea, unsupported, and as passionate as they were about long-term care, they both left, and neither of them have gone back, which really makes me sad.
Oh, that is too bad. And, when you think about turnover too, there are some questions, to even ask yourself, what are the ways that your organization could better spend that money, right?
Right.
Continuing education, new equipment, even 2 more nursing assistants, or think about the other costs to an organization and how does that affect you when, the nursing turnover is high. Staff morale can be impacted enough to induce even more turnover. Increased overtime can lead to burnout, and even training new staff that might be likely to leave within a year. That can be difficult. As well as another question, how does nurse turnover impact residents that you are caring for?
Yeah, and let me just make a comment on that. Nick Castle, who many of you probably know about, has done a lot of research on turnover, and the title of one of his articles is "Turnover Begets Turnover," and it's true. One staff leaving actually has an impact on other staff. The turnover actually that has the greatest impact is the DON. When the DON leaves, the turnover rates go up. And so it causes it's not only a cost to staff morale, but you lose continuity of care for the residents and continuity of somebody to go to when something is needed for the family members. So a turnover it's just really costly in so many ways.
It is, and it even changes the culture of the unit and the facility with turnover.
Mm-hmm.
Another question is, how can the constant rotating of nursing staff provide that consistent individualized care, right? Because staff know their residents, they understand their preferences, the family supports, and even some of those complex medical and social issues the residents have.
Well, and there's other research that shows that identification of early change in condition is improved when you have continuity of CNAs, which makes sense. I'm sure doesn't need to be explained. They know the residents, they can pick up subtle changes that, of course, a new person wouldn't be able to. So it just has so many ramifications.
Absolutely. And sometimes as well, when someone leaves, there may be staff that leave with that person.
Mm-hmm.
So it is important to really take a good look at the turnover.
Yeah, one last comment I wanted to make on the turnover is that one of the things that's kind of invisible to supervisors and administrators is that when staff leave, when somebody turns over, you're right, Sue, that it has an impact on other staff, and they don't leave right away. There's always, or most of them don't, there's a lag time, and that's a time when actually the organization administrators, leaders in the organization could intervene to improve things to keep people there, because it's not inevitable that they'll turn over, even if that's their plan.
Absolutely. That is a really good point. So providers of aging services are struggling to reduce the turnover of nurses, and the nurse residency programs may offer a solution. And so for almost 4 decades, Dr. Barbara Bowers has been conducting research of the needs of older adults and the needs of professional staff and providing individuals with that needed care. And therefore, it's not surprising that Barb has always encouraged her nursing students to start their careers in the field of long-term care services and supports. And generally, nursing students resist the idea of working in nursing homes and assisted living communities. Is that not true, Barb?
Yes, it is. And there are a couple of not so obvious reasons. One of them actually relates to residencies. It's amazing to me how many students, undergraduates, as they leave our programs, and this isn't just our program, it's all over the US, say, I'm going to a place that has a residency program. So they're all applying to hospital residency programs. Why? Because for those of you out there who are nurses, if you can remember this, when you graduate as an undergraduate, you don't feel terribly confident and you don't know all that much. And even if you think you do, your first 2 days of work confirm for you that, in fact, that's not the case, that you have so much to learn. And so we lose a lot of people due to the stress of feeling unprepared and insufficiently supported really early on. Obviously, turnover is not just a problem in long-term care, but most of the nurses who turn over, we lose from the profession. And we can't afford that now.
Sometimes, Barb, also that we hear that the nurses coming out of nursing school feel that they won't be able to use their skills because long-term care, yes.
There's a good one. We actually did a study several years ago where we started off by asking our nursing students how many would like to work in long-term care or work with older adults in long-term care settings. Not very many said they would. They weren't all that interested. They said, you can't use your skills. It's boring. It's not very respectable. They wanted to do something that really required a lot of skill, like helicopter nursing or emergency nursing or ICU. We put them through a program where they took care of older people in the hospital and then followed them into the long-term care settings. And then we repeated the survey. At the end of that, they said, was still a very low number who wanted to work in long-term care. And we were like really disappointed. So we interviewed them. And what they told us was, well, in the beginning, they thought it was boring and you couldn't use any skills and you actually never developed any skills. You didn't need to know much to work in long-term care. Now, after they'd had the experience, they were terrified to work in long-term care because they realized that the skill level was actually higher and the support in the environment, the resources, other nurses, backups with physicians and respiratory therapists, whatever, was much less. And so the reasons changed. So that's why we said, geez, we really need a residency program to help that transition from undergraduate nursing student to competent nursing home nurse.
So clearly our field must convince students today that are now enrolled in the nursing programs around the country that the jobs we offer in long-term care are challenging and highly skilled as well as highly valued.
Right. And I think actually nursing homes can play a huge role in this. Chris Miller at University of Minnesota has developed a program to help nursing homes figure out how to structure clinical experiences for nursing students. That's the way to get them in there, to have a good experience, not to bring them in to work as a CNA, but to really work with the nurses to see the challenges, to see, I think what's often not appreciated, even by other nurses, is care of older adults. Geriatric care in long-term care settings is hard work, but it also is a real specialty. It requires exceptional levels of skill and experience. Not just anybody can do it. Even nurses who come from hospitals with years of experience find it challenging. So I think we need to stop minimizing what's required of nursing home nurses.
So even more important then, we really need to make sure that our team is fully prepared to carry out their job and supported in their work. So this is where I'd like to introduce a long-term services and support nurse residency program called GERI-RES, because it will elevate the status of the long-term care nurse professional. So Barb, Can you
Yes.
tell me more about your research, and would you provide an overview of how GeriRes became a reality and why this program is so important in today's long-term care industry?
Yeah. So GERI-RES is a nurse residency program. We realized that we could not really model nursing home residency programs after hospitals because it required a much higher level of resources. It was basically inflexible in terms of the timing. So it was like Monday, Wednesday, and Friday, regardless of what's going on in the organization. Hospitals can do that. Nursing homes can't. So we wanted to do several things with the program, creating a really robust transition to practice program. It's based on research, solid research. Everything is evidence-based. All of the care processes, whether it's quality of life or pressure injuries, it's all evidence-based. So there was a lot of research that went into that, and we had experts in each of these areas, which you'll see in a bit, the different clinical areas, but in each of the areas, we had experts reviewing them, and it was based on sound research. But we also, in terms of developing the program, we wanted to make sure that there was a really good fit. So looking at hospital residency programs, we decided there were almost to a T, things didn't fit in terms of the structure of the program. There were some things that worked, like having a coach, having the organization being supportive, and having a prolonged residency program with a mentor for the new nurse. Those things we saved, but we're doing them all differently. So we started off by having a stakeholder meeting, which was nurses, nurse supervisors, DONs, administrators, executive directors of nursing homes, regional supervisors, DHS representatives. So we did a wide invitation of people, and we had many meetings to look at, first of all, what were the modules that we needed to have. Well, the first meeting came up with 45. Obviously, we don't have 45. We said we have to whittle this down to something that's manageable. So you'll see the results of that. But also, we talked a lot about how would this have to be structured. Everybody agreed that online was the only way to do it, and that it couldn't be synchronous. So we couldn't say every Tuesday from 2 to 4 because we didn't know. That would really mess with scheduling. If nurses weren't available, it wouldn't work. If you were short-staffed, it would be a problem. So it's asynchronous, meaning that the online portion of it is all done at the time that is convenient for the coach or the nursing home, the new nurse resident. Word resident gets a little confusing because we've got residents living there and then nurse residents. So it was developed over many, many months and meetings with people so that it would be something that fit nicely. And we also wanted to make sure that as we put the modules together, that we were very cognizant of rules, regulations, policies, and procedures that nursing homes needed. And we set up the program so that as we got to each module, the assignments, many of the assignments included the requirement for the nurse resident to actually explore something internal to their organization and learn about that, as opposed to central residency programs, which are like policies in general. And so it was sort of a way to help new nurse residents learn about the organization they were working in. And then we realized after the first time we pilot tested this several times. The first pilot, we realized that we had insufficient organizational support. And I can give you a couple examples of that. The support of the organization, tangible support, visible support is really important because feeling supportive doesn't actually go very far. I'll give you a couple examples. One of the things we ran into repeatedly was nurses already working said, how come you get to do this residency program? I never got to do this. So it was not only an educational program, but we asked the organizations to commit to a transition, meaning please don't throw people in as a charge nurse on day one because they're not ready for it. And so actually, this is one place where HR became really important because we needed HR to be on board to not schedule people, to understand where this person, the resident, was in their transition to practice so that it was graduated over a few months before they actually got full responsibility. And that's a place actually where we saw turnover when it wasn't adhered to, that nurses just kind of freaked out actually and said, I'm terrified. I can't manage this whole unit by myself, especially new grads, but not just new grads. And so we learned those things about our organizational support that was really important. The other thing that we saw that was pervasive was, as I started to say, other nurses saying, I didn't get to do this. So that kind of clearing the way with other nurses who are already working there to say, it's in all of our interest to support this person. We have a new program. Yes, nobody else, people already here didn't get to do this, but it's really important for us to bring nurses on who will actually perform at a very high level much more quickly and won't leave. So we need to support this, and having a little bit less assignment, less responsibility, but having that graduated is actually the way we're going to keep nurses, and sort of bringing the staff on board, but being very visible in doing that. Because that was something that scheduling people to gradually take on more and more responsibility. The third thing that the organization can do that's really important is, I think, making sure that the nurse resident and the coach or mentor are actually scheduled, that their schedules overlap or dovetail in some way at least a couple of times a week, so that they actually have a chance to get together. So those are three, they're not terribly onerous things to do, but those three we found in our pilot research were really important for the success of the program.
Excellent, excellent. So we know that GERI-RES was developed by the Center for Aging Research, University of Wisconsin-Madison School of Nursing, and it translates current evidence to relevant and accessible workforce solutions, right, for the contemporary yes. long-term care practice setting, which then really bridges that research and practice to a turnkey program, yes. right? Giving you everything that you need to implement that world-class geriatric care nurse residency program.
Yes, yeah, and that's really important. We know, I'm sure, nurses out there know that our undergraduates are not prepared to take a lot of responsibility clinically on day one, and particularly not in long-term care. The vast majority of students get through undergrad and never have a long-term care experience. And so they end with the same kind of unrealistic and negative views that unfortunately are pervasive out there. So having this program will really dispel a lot of that. And again, I encourage you to include undergraduates, nursing students in your programs. So it has three components to it, which is very similar to other residency programs. There's a clinical coach, which is vital. This is a mentor, a person who is a support, a confidant, who would challenge the new residents, guide them in the organization, introduce them to people, take them to the HR and say, this is the new person, she's transitioning, here's the schedule, meeting supervisors, meeting the social worker and the activities people, introducing the CNAs. This makes people feel like, gee, I'm welcome, they want me here. And it sounds kind of silly, but it's actually really vital for people to get beyond their orientation before they start looking for another job. So that's a major component of this that we have done very carefully. And we know that most nurses have not been trained to be coaches and mentors. We're actually starting to do that a little bit in our undergraduate program, but nursing programs are way behind on this. We need to do a lot more. There's skills in there. A lot of people don't necessarily come by this naturally. So there's a skill and a training program that we've included. And then there's the, we've done recognizing that there are a lot of LPNs, LVNs in long-term care, in addition to RNs, probably more LPNs than RNs. We have been very aware of differences in state laws, differences in training programs. And I know this varies across states, but try to be really aware of the fact that there are some differences. And so we've set up the program GERI-RES to reflect those differences.
And so the clinical coach will go through their own modules
Right.
and be prepared to be that clinical coach. And then the RN will, or the LPN or LVN will go through their own modules as well. And what's really nice about those modules, which I myself have had the opportunity to go through, they take about an hour each, and they're paired with exercises and quizzes and interactive videos, and then allow time with the nurse coach. And what's nice about the online forum means that the curriculum modules can be accessed anywhere, anytime.
Yeah, we set it up so that the coach goes through first. So they have a really good understanding of, say, principles of adult education, comment how to be supportive. One of the things that the coaches asked us the most frequently was, what do I do when they get something wrong or do something that I think is like really dumb? Well, first of all, you don't say that. So a lot of the modules are about how to give feedback in a way that people feel supportive, but get the information about where they need help, where they need to work harder, where they need to do more. So that's a skill. And not everybody knows how to do it. And again, this is really important for nurses, new nurses, to feel like they're welcome, they're appreciated, they're respected. So that's a lot of the coaching module. And one of the some of the feedback that we've gotten from a lot of DONs is that they really like the coaching model. In fact, some just wanted to put lots of people through the coach model because they say, geez, they really know how to welcome new employees. Even if they're not mentoring a nurse resident, they're much better at welcoming newer people, have developed some skill in terms of figuring out how to make people feel supported. So I think that's really, so it gives you two things there.
Well, I think it's really nice because those coaches then serve as role models, right, Barb, for
Right, exactly.
nursing interventions. And you had mentioned a little earlier about how they can help really introduce to other people and become socialized into the culture of the facility, as well as to the nursing profession for long-term care as well. And so it will help with turnover because it increases that nurse resident confidence and competence within the facility.
Right. And it is interesting what happens to people when they are suddenly invested with the authority to make people feel welcome. It really does change their behavior. And so this actually has had an impact that sort of goes well beyond the nurse residency program, which is great.
Right. And they don't do things for the nurse. They actually do things with the nurse so that they can work together and teach and coach and support. That support is so instrumental today.
So they will go through each of the modules. So then once they finish with this, the nurse resident will start going through the modules. And we suggest actually don't do them in order, do them in a way that aligns with their experience. So if they've got a person who is dying, actively dying in the nursing home, go to the end of life module and go through that one. Because as we all know, I think, education is much better. You remember things, you appreciate them, you understand them much better if you actually have an experience of that situation at the same time. So the coaches then go through that. They will review the assignments that the students have done and talk to them. And that's where the feedback comes in. When the nurse resident has written something that the coach thinks is just completely off the mark, how to give that feedback and guide them back to where they need to be. It also gives them a really good sense of where the strengths and weaknesses are of this person, and they can even suggest other continuing education that the person might need.
And there's a guide and resources for that clinical coach that go along with the modules that assist them in working with some of the difficult decisions and working with new nurses of all different levels with all different backgrounds to work with not only the importance of long-term care nursing, but also to help them within the culture of the facility as well.
Yeah, I think they have a very strong role in both. And I just want to emphasize that this is not these are not academic tools. They're actually written in a way that is, we hope, meaningful to people in this environment, not written to researchers, so that hopefully it's not extra words, it's written parsimoniously. We know people are busy and wanted to kind of get right to the point and tell people just what they need to know. There is also an organizational guide. So the modules, as I said, we had a hard time coming down to, well, we got it to 16 modules. Now I know that this program is 12 modules to be recognized as completing the program. Oops, there we are. Yeah. Oh, sorry. That's the previous
The
one.
other one, yep, that was the first one here is the clinical coach.
Yeah, sorry. Yep. Yeah. So these are the clinical coach modules. So
And this whole process only takes 3 to 5 hours to complete.
right. Yeah.
So it's not time intensive.
Right. Yep. And there's a reference guide if people are really excited and want to learn more. And we have had people do that. We've actually had people say, I want to go back to graduate school and do more with this, which is terrific. But, you know, it's things like how to give people feedback, helping someone develop clinical judgment, which is obviously important, working with interdisciplinary teams, and sort of addressing the helping people feel like they're welcome in the environment, and what is the role of a mentor and how that's different from disciplinarian, auditor. It's not those things. It's a real, you're helping to develop this person and to nurture them. We all appreciate that. Okay.
We do. And then we have the 12 modules for required modules. There's more than the 12 required, but these are the 12 required modules for the nurse residency program.
Right. And so these were the ones that we had a heck of a time coming to agreement on, because there were so many more that people thought were vital. And so there are more there if people want to keep going. As Sue was saying, there's lessons for each one to get people not just, this isn't about memorizing, this is actively involved in doing things. And so in some places, like go to the HR person, or go to the quality improvement person, or the infectious disease person, and find what are your policies in your organization that deal with this particular issue, so that they actually, we're not taking them outside of the organization, we're focusing them back in, so that when they learn how to do things, they're learning also about the organization that they're in.
Right. And so these are self-paced online courses that will prepare the RN to become highly skilled as a practitioner in post-acute care and long-term care. Each enrollee will receive 12 months access to 18 of the modules. Now, 12 of those are required, but 18 will be provided. And those include orientation and support materials that come right along with that. And each module topic will take approximately 1 to 2 hours to complete. And it is strongly suggested that a nurse complete no more than 1 module per week over the 18 weeks.
And just to remind you again, I think it's really nice if you can figure out who are the residents that this new nurse resident, who are the residents living there, that the new nurse is going to be interacting with, and to pick a module that relates. I mean, quality of life can probably relate to anyone, but if you've got somebody with a specific mobility problem that's new in particular, go through the mobility module and have them do the assessments and bring it back and talk about what's your clinical judgment on this? How do you want to proceed? And it will, I think the other things, one of the things we did was we talked to nurses who were not that far out of becoming new nursing home nurses about what are the things that really worry you. So we have a combination here of things that I think that nurses who start in nursing homes are not sufficiently knowledgeable about. Pharmacology is a good one. Skincare is another one. Pain management, as much as we'd like to think we all know that, there's a lot more to learn. But also, like, how do you deal with families who are unhappy, with families who are, maybe there's a conflict within the family, or, how do you talk to a family about things have changed? Disputes among staff members. How do you deal with all those things, as well as general quality of life issues for residents.
And just to also reiterate that facilities will need to have that clinical coach in place before
Yeah.
enrolling any nurses in the RN or LPN programs.
Right. Yes. They have to have somebody prepared to jump in day one and mentor. And they need to have some time together. It could be Zoom, but it needs to be, and that's something again that is important organizational support, is make sure that maybe one ends a shift at 3 and the other one starts, and you can let one off half an hour early, another one comes half an hour early, and they've got an hour together. Or it may be that they're on the same shift, even the same unit, and they can have lunch together if people have time to have lunch. But some kind of overlap of time is really important.
And so this gives you a look at what the program really appears when you're going online. And there are numerous, once again, interactive processes within each module. There are video vignettes, there's audio, self-paced reading, there's resources, worksheets, learning activities, and much more. So the program is highly interactive within it of itself as a program.
Right. And then interactive with the coach.
Yes, and then interactive with the coach, exactly. And then, as we mentioned earlier, there are 6 additional modules that the nurse resident can also complete in the areas that you can see here on the screen, which are, again, highly recommended. However, they're not required to successfully complete the residency program, but areas that would make the nurse residents much more comfortable in their role as a nurse in long-term care.
And let me just add that I think today, with the attention at a national level, which is well deserved, on change of condition and care planning for person-centered care as well, that this is a really important module. So I had a hard time. One of the things I was asked, I know, was which ones are really should be in the 12, and I couldn't take any of them out. So
I know it's hard to choose, isn't it?
Yeah, terrible. Yep.
So Barb, can you summarize for all of us the benefits of GERI-RES and how does it prepare the nurse for success?
Yeah. We have a lot of anecdotal data, and we have some measures that we did. And in our pilot study of the several organizations that participated early while it pretty much been developed, although we've done some tweaking since then, we actually doubled. I'll say we doubled. The retention rate doubled in the nurses who finished, new nurses who completed the GERI-RES program, compared to those who either quit really early, quit the GERI-RES program early, or didn't, or were not included in the GERI-RES program. We had some where they didn't have the coaches, so they didn't include them. So the retention rate was double. Hard to say exactly what contributed to that. I'm sure that at least some of it, a good portion of it, was the GERI-RES program. And we talked to the nurses and asked them why that had made such an impact. And they said things like, we just felt so respected and appreciated that somebody recognized that this is the level of knowledge and skill that we need. Probably the most common comment we got back was that they were really appreciative of the organization, the leadership in that organization's recognition of how important it was to learn these things, and they felt supported by the organization. And that's actually one of the reasons people leave most commonly. So I think that probably was really important. We also, in each of the area, the test scores increased significantly. So I think we don't have any measure of recruitment, but all I will say was, I remember an assisted living organization that said, they called us in a panic and said, we need this residency program because we had 3 applicants, all sort of friends from the same school. And they said they really wanted to come to assisted living, and did we have a residency program? And we said no. And they said, oh, well, then they were going to go someplace else. And so they said, can we get that residency program so we have one? I don't know the end of that story, what happened, but I do know it aligns well with what I've heard from our nursing students, that they feel like they need a residency program as they start practice.
Okay, so let's talk about access and how we can, be able to access the GERI-RES program and learn more about the nurse residency program. So on the screen, you can see that at the www.pathwaylearning.com, the courses are available for the coach, and then also for the RN residency coach, and for the RN residency, and then for the LPN or LVN residency. So if you go right onto this website, you will be able to access and learn more about the program. And if you choose to sign up for the program, you would be able to sign up for the program there as well. You can also learn more about GeriRes at the two websites that are listed here as well. There's a video that you can watch, and then there's also a link that provides you with downloadable material where you can actually read more and learn more about the GeriRes program. So Barb, do you have any final thoughts today on the GeriRes program?
Only that I think it's vital that nurses who work in this setting are recognized for the skill required and have an opportunity to learn the things that they need to learn, and to be supported. In the middle of the crisis we have now about staffing, this seems like sort of a minimum. Hospitals figured this out a long time ago. And I know we're in a really, really tough environment, but I think this is one way that nurses can feel like the organization is invested in them, and they have an opportunity to grow professionally from this.
So one of the questions that we had in the chat box, Barb, is this program just for new nurses, or could it be used for nurses who have worked in the field but have not received additional training for long-term care? It seems like it would be a great refresher as well.
Yeah, Glad I was going to say something, and then that just sort of slipped away. We had a number of nurses who were not new, but opted to take this program. They thought it would be a good refresher. And the feedback that we got was it was not only a good refresher, but it was a lot of new knowledge that they actually hadn't had access to, in particular in managing depression, identifying and managing depression, pharmacology. And a number of them said they actually never had the information that was in nutrition and end of life. So I think it is for probably any nurses can benefit from it. So yes, we've had a number who have gone through voluntarily because they thought it would be a good thing for them to do.
Okay, so I'd like to open it up for any other questions that we would have.
Is there a volume discount is another question.
Oh, that is a good question. We can actually send that out. We can check into that and send that information out to you.
I want to say I can't speak to the discount because I'm not part of Pathways, but I can speak to the benefit of doing it in a group. And we just had a group actually in Palestine go through this with a coach on our site, somebody at Madison who acted as a coach, 26 nurses and their director of nursing who went through GeriRes because it was the only, they have no access to continuing education. And to watch them work on this together and try and figure things out together as a group and do the activities as a group was wonderful. And I know there are other groups. I think it's actually ideal if you have at least 2 or 3. I know nursing homes don't hire huge cohorts like hospitals do, but I think having a buddy to go through with is a really good idea. Very, very supportive for the nurse resident and efficient for the coach.
Yes, we do have a discount, and we can work on setting up a hub and coaches and mentees. So there is yes to that answer. Any other questions that you would have on the program? Well, if you do think of questions or you would like to ask those individually, feel free to go onto any of those websites, those web links that we showed you earlier. and contact us, and we'd be more than happy to return your call and answer any of those questions. Okay, well, I would like to thank Barb for joining us today. It was a pleasure always to hear your vast knowledge and research, and this is just such an excellent program. I have been impressed from the day I learned about it to going through all of the different modules myself, and I thank you for talking with us today.
Great. Thank you.
Thank you. Have a great day, everyone.